The New York Health Act was an attempt in the late 90s, early 2000s to create a universal healthcare system in the state of New York that was open just to residents of the state of New York. And it almost happened. In order for a law to pass in New York State, it has to be approved by both houses of our Congress, our state government in Albany. We have two houses, the New York State Senate and the New York State Assembly. And back in the 90s and early 2000s, the New York Health Act passed through the Assembly 5 times, but it could never make it through the Senate. The way it works is like pretty simple and pretty clever, right? If the New York Health Act ever were to go into effect, all health insurance companies become illegal in the state of New York. You can't have any more Aetna, you can't have any more Independent Health, you can't have any more Blue Cross Blue Shield. However, you continue to pay your monthly premiums. But instead of paying it to a health insurance company, every New Yorker kicks it into this one giant pool of money called the New York Health Trust. And then all healthcare in New York State becomes free. And when the doctor wants to get paid, they have to contact the New York State Department of Health. They say, hey, here's the receipts, here's the records, here's all the work we did, here's all the patients we saw, here's all the treatment we did. Can we get reimbursed? And then the doctor or dentist or nursing home, whatever, gets reimbursed out of that giant pool of money, the New York State Health Trust. There's 2 really nice things about it for you. Number one is it puts all healthcare in one network in New York State, right? Like you don't have to, there's no longer such a thing as in and out of network. You just call whatever pharmacy, urgent care, hospital, whatever you need, make an appointment and you just go. And then the other thing that was going to be nice about it was everyone agreed that we probably were going to be able to get more healthcare for the same amount of money if we did it that way. Number one, because you're removing the for-profit insurance companies out of the entire equation, right? These people who have to jack up the price to make a profit, they're just gone out of the entire thing. But number two, there's a lot of like efficiencies that you can find by streamlining it like this, right? By, all the insurance companies are doing redundant double work. You can make it more effective, more efficient if you get rid of them and just make it all one giant system that's being overseen by the New York State Department of Health. It's been 8 years since the last time the New York Health Act passed through the Assembly. It's kind of like there's not a lot of momentum going on right now. And if it sounds like the type of thing you'd like to see happen in your lifetime, literally the only way to make it happen is just to start pestering your politicians. Like start pestering your representatives. Just send them emails. Make posts about it. Make signs. Take them to the No Kings that say like pass the New York Health Act. Talk to friends and family, tell them about it. I would be shocked if like 5% of New York State residents even knew that this was a thing, that this was an option. So like just talk to friends and family about it, let them know. Try to get them to encourage and pester their politicians to do it. Because the only way that politicians ever do anything like good for regular people is if they just get like bullied into it. So start bullying.